Providence from Providence Health. Thank you for joining us today. My name is Beth Schenk, Executive Director of Environmental Stewardship for Providence, one of our nation's largest health systems with over 50 hospitals and 1,000 clinics in 7 Western states. Almost a year ago, we declared our commitment to become carbon negative by 2030. Healthcare is here to provide care and promote health, yet unfortunately, we also pollute significantly. Healthcare emits 8.5% of the nation's greenhouse gases. We use many concerning chemicals in our operations and pharmaceuticals, and we use tremendous amounts of supplies and equipment, which leads to enormous amounts of waste, and the waste serves as an indicator of excessive and sometimes inefficient consumption. This pollution and consumption harms our natural environment, contributing to climate change and other pollution, which then in turn puts health at risk. This is not a cycle we want to be a part of. A majority of individuals working in healthcare are clinicians with licenses or registration, or work in the clinical delivery of care in some way. Yet, in efforts to reduce the significant environmental impacts from healthcare, often clinicians are not part of the equation. Their time is valuable, they are incredibly busy, yet we need the expertise of clinicians to help change processes, practices, and purchases in healthcare. Today, you will learn from a clinical leader in Dr. Brian Cheesebrough. Dr. Cheesebrough is a physician and anesthesiologist who serves as Medical Director of Environmental Stewardship for our Oregon region, but leads numerous efforts across our entire health system, addressing the complex relationship between clinical practice and environmental stewardship. I'm thrilled to have the chance to talk with him and explore his thinking and work. Dr. Brian Cheesebrough, welcome.
Thanks, Beth. It's nice to be here. Thanks for the invitation.
You bet. Well, it is not every day that a hospital system has a physician who is a medical director of environmental stewardship. Tell us about that. What does that mean and what do you do?
Well, just to take one quick step back, you're absolutely right. We in healthcare occupy really unique ground with respect to climate change, environmental stewardship, and public health. The WHO considers climate change to be the greatest risk to global public health in the 21st century. So we really need to pay attention and help build health resilience in our communities and adapt to our changing environment. Yet at the same time, as you mentioned, the healthcare industry has a significant environmental footprint of our own. The health impacts of our healthcare generated pollution are estimated to be on the same order of magnitude as the impacts of preventable medical errors, which we're all well aware of. In some ways you could even argue that our disproportionate U.S. healthcare footprint is yet another medical error of sorts. So we do need to get to work in addressing all of our errors, and this one through mitigation of our footprint. And having a medical director of environmental stewardship really recognizes the crossroads that upon which we sit between taking responsibility for our footprint as well as responsibility for the downstream impacts on public health, such that stewardship and health are really inextricably linked in our approach to healthcare and medicine. In Providence, our vision is health for a better world, which I really personally appreciate and respect. And I would say equally relevant to our approach is the inverse of that vision, which would be a better world for health. To realize these complementary visions, we need the engagement and expertise of all of our caregivers, including our patient-facing clinicians. And that's really what I try to do in my role as a medical director, is tie it all together and work to engage clinicians.
That's great and so helpful to all of us as clinicians. So through your expertise as an anesthesiologist, you've really led the way nationally in understanding environmental impacts of administering lower emissions anesthetic agents. You have made meaningful change in Oregon and across our health system, which has lowered emissions from anesthesia significantly. Tell us about that. And we're excited to hear about your results and also your process. Thank you.
Sure. Obviously, as a clinical anesthesiologist, the impact of anesthesia is near and dear to my heart. It's a complicated subject, but overall in anesthesia, there are 3 commonly used anesthetic gases. There are some relatively minor clinical differences between the 3, but there are major differences in their respective potency as greenhouse gases. The clinical management decisions made every day in our operating rooms determine what anesthesia emissions eventually find their way to the atmosphere. Here on this slide, we're looking at the proportional clinical use of these gases for every anesthesiologist and CRNA in Oregon in 2016. Each bar here is an individual clinician, and the colors represent one of the three anesthesia gases. The most potent greenhouse gas anesthetic is desflurane, represented here by the color blue. So you can see our baseline practice in 2016 contained a fair amount of blue. Blue is bad. So approaching our colleagues through a clinical quality improvement framework, we educated, we engaged, we inspired, and kind of ran this iterative quality improvement loop over the years since 2016, and inspired them to change practice. Can you advance to, there we go. So here we see the results in 2020, and there are huge reductions in the amount of blue that we see in the state of Oregon. And I really like looking at these individualized data because it highlights the importance and significance of everyone moving together toward a collective goal, right? Any one individual alone may not seem that significant, but with everyone moving together, the impact is pretty dramatic. And here are the emissions results of all of those clinicians' efforts. Based on our baseline in 2016, in 2020, there's been a 95% reduction in our greenhouse gas emissions from anesthesia. And that emissions reduction is the equivalent to driving 500 fewer miles in a Hummer. And I couldn't be more proud of our anesthesia colleagues in Oregon and those in our other Providence regions and other health systems taking similar steps to reduce our collective anesthesia footprint. It all adds up.
That's great. And also it adds up to cost savings, doesn't it?
Yeah, absolutely. So as it turns out, desflurane bottle for bottle is twice as expensive as the alternatives. So in addition to a 95% carbon emissions reduction, there's also we saw a 70% cost reduction in inhaled anesthetics year over year. So,
and the quality of care delivery is just as good.
Yeah, absolutely. Most people or most anesthesiologists kind of push back a little bit in terms of clinical workflow efficiencies. We were always taught that patients with desflurane wake up faster, but in real world clinical practice, we've shown that that's not the case. That with practice, anesthesia clinicians can wake patients up just as efficiently using a lower carbon, lower cost anesthetic technique.
That's great. It's a real win-win. And this is something that I've seen in our environmental stewardship work is very often when we're making the right choice for the environment, we're saving money, which makes it a little bit easier. Well, thank you for explaining that. That's so interesting. So I have another question for you. Just thinking broadly about clinical practice across the professions, what opportunities do clinicians have to reduce environmental impacts?
Oh my goodness. I mean, there are opportunities everywhere you look, pretty much. With mitigation, from a clinical perspective, I think it's really important to realize that our clinical delivery of care in a large way drives consumption and demand for the resources used within healthcare. So taking a critical eye to the way we deliver clinical care through a stewardship lens reveals tremendous opportunity to reduce our impacts and improve efficiencies. We should really strive to factor our decisions and behaviors by taking a total life cycle cost of ownership perspective. Looking at source reduction of materials on the supply side, the environmental costs incurred during the clinical use phase, like anesthesia emissions, as well as the downstream impacts resulting from end-of-life disposal of items. Along those lines, at Providence St. Vincent here in the Portland area, we implemented a surgical supply optimization approach where we utilized epic data and process engineering to reduce the amount of wasted or unnecessarily used clinical supplies, as well as sterile reprocessing of durable equipment trays. And that process, as a result of that process, we've reduced the associated greenhouse gas emissions by nearly 1,000 metric tons of carbon equivalent, and cut our water consumption by nearly 1 million gallons per year as a result of processing about 75,000 fewer unused but opened surgical equipment trays. So working on the supply side of the equation is remarkably effective in reducing environmental impact. Similarly, we last year we conducted an in-depth environmental life cycle assessment of our laundry and linen service in the Portland area, and found that laundering a single blanket consumes nearly 2.5 gallons of water and emits 2/3 of a kilo of CO2 equivalents. And our clinical use and consumption of linens is the direct driver of these downstream impacts. So every time a clinician grabs 3 blankets when really one would do the trick, we generate a tremendous amount of unnecessary and unintended environmental impacts. And a similar kind of approach could really work in any clinical unit. Use what you need, don't open what you don't use, what you're not going to use. And it sounds so simple, but again, when taken across, individual actions, when taken across a hospital system with 50 hospitals and tens of thousands of caregivers, this kind of work adds up to really significant impacts pretty quickly. In addition to the source reduction, clinicians also play a large role in pushing healthcare into a circular economy model where we can strive to maximize the life and use of products and materials through strategies of reuse, reprocessing, repurposing, recycling. Our current practices, the way our supply chain works, often we create this ongoing demand for resource extraction and manufacture of single-use disposable items, which we use once and then subsequently landfill or incinerate. And that's an example of a linear kind of take, make, waste approach that's really inherently unstable. And as the end users of so many of these products, clinicians, as consumers, our demand can alter the supply, and we can and should demand more sustainable options going forward. Beth, you've in your role, you've been incredibly active in addressing environmental sustainability and healthcare stewardship from a nurse's perspective. Along the way, what have you seen and learned, and what can you share with us?
Well, thanks, Brian. Yeah, I come at this through a clinical lens as well. And I realized when I was early in practice that the way we practiced was a problem for the planet. I mean, I had already been engaged in environmental stewardship and wilderness protection and that sort of thing. And I got to healthcare and thought, whoa, we create a lot of waste. At that time, climate change wasn't so much a conversation, but waste certainly was. So that's kind of how I got started. And over the years, I've realized that nurses are in the middle of so much in healthcare, including leadership positions, and we can have a real impact on these things you discuss, from supplies, waste, chemicals, even healthy foods. And so this makes environmental, I think what we were talking about earlier in terms of when we degrade the planet, we are degrading our opportunities for optimal health. Therefore, all of this is a practice issue, and I think it's a nursing issue. So all clinical professions have oaths or standards, and this slide shows us that in medicine, a common one that is quoted, it's not the full Hippocratic Oath, is first do no harm. We take that through all of the professions. The one on the bottom on the left is from pharmacy, and they have also lengthier statements, but they commit themselves to the service of mankind and relief of human suffering. I think all of the clinical professions have standards that commit us to health. Nursing has two I want to point out here. One is we have a social policy statement that links a lot of different things to our contract with society, and then what society promises us as well. And one of them is that it clarifies that we are here in our practice, we need to promote the health of the public. Now, you and I have talked about this a lot, that when we're in an acute care situation, caring for the patient in front of us, it's not always easy to think of these global issues like climate change. And yet that's what we're asked to do with this commitment, that we want to think about the care of the public as well as each individual. And then the other statement there is our standard of practice that says the registered nurse practices in an environmentally safe and healthy manner. So I don't think we can get much clearer about that one, that we need to basically not pollute in our practice. So I do think we have a professional obligation, and also we're well positioned to reduce environmental impacts of healthcare. Another way I've been engaging clinicians is by measuring their perceptions, motivations, and behaviors about climate change and health. I've led the development of the Chance survey, and I invite any health professional who may be here listening right now to point your phone camera at this QR code, and it will open the survey on your phone. We developed this survey in 2017, tested it in 2018, and have been collecting data ever since. Though we started with nurses, it is now open to all health professionals. So please, I welcome you to take it. It's been used in over 30 nations now, and it is currently available in English, Spanish, and Portuguese, and soon in Finnish and Korean, because we have students there working on it. This website here is where the survey is housed at Washington State University, where I'm adjunct faculty. You can learn more there, and also we have a way that people could use this in their own research, a way that people can log into the survey themselves. The respondents so far have been quite aware of the impacts of climate and health, and yet and motivated to act on it. However, the main reasons they do not act is that they're overwhelmed, they don't know what to do, and it's too complex. So that's why it's important for us to help explain, link, and break down to other professionals who may be interested, but not quite as interested as we are, perhaps, and don't really know what to do and where to start. I also was really surprised that we have categories: never, rarely, sometimes, frequently. And when we asked about how often they contact elected officials about climate and health, the vast majority was never, 60%, or rarely, another 22%. I was surprised by that. So we do have some work to do on advocacy. In the end, I feel that working toward planetary health, including addressing climate change, is a professional obligation for many, if not all, of the health professions, since the professions pose such risks to health. Further, I feel we're in privileged positions. We're well educated, very, very respected, typically have socioeconomic advantages, and we speak from powerful platforms with strong voices. I hope that in our journey in Providence, we will gather many clinicians to join us in this effort. And as you have made clear, Brian, we need clinicians' expertise to make the needed practice changes. I'm so happy to have you as a partner. So let me ask you a slightly personal question.
Okay.
Which is, so it's clear that this topic is important to the world and to you personally, but what sparked your interest and what drives you in this work?
Well, really stepping way back, right? So as a kid, I was raised on a ranch in western Montana, not far from where you live. And growing up on a ranch, stewardship of the land and water and air is really important and became a core value that I continue to hold today. And while I no longer live on a ranch, I live in a city, stewardship and kinship with our environment is no less important or relevant. Several years ago, I was really struggling through a bout of solastalgia, otherwise known as eco-grief or eco-anxiety. And you develop this feeling of hopelessness or helplessness about the health of the planet and people. And rather than kind of ride that descending spiral, so to speak, I chose to do what I could to take as active a role as possible in addressing stewardship in my greatest area of opportunity and influence, which is healthcare. Coming from a background in addressing clinical quality in anesthesia and perioperative medicine, I have certainly found that applying that quality perspective and approach to issues of healthcare sustainability is particularly effective and resonant with clinicians. Adopting specific stewardship metrics really helps focus attention and helps all of us hold ourselves accountable for the impacts of healthcare. With respect to the health impacts of environmental degradation and climate change overall, we all contribute to this global crisis, but the suffering really clusters in vulnerable communities where the degrees of exposure, susceptibility, and underlying disparities are the greatest. And this injustice really is compounded as these poor and vulnerable populations, they're often the ones who contribute the least, the fewest emissions, the least amount of pollution, yet they disproportionately bear the brunt of the health impacts of environmental damage. And within Providence, justice is one of the core values of Providence. And it's a value from which I also draw inspiration as we work to focus our commitments toward issues of environmental justice.
Thank you. Well said. And it does remind me of one of my favorite quotes from Laudato Si, which is the Pope's encyclical on the environment, when, this is paraphrasing, we do not have a social crisis and an environmental crisis. We have a complex, integrated socio-environmental crisis, which must be solved by treating the same root causes. So I think you're absolutely right. And that resonates with me in Providence and personally, that to anchor this injustice and know that we're helping to heal in two directions as we approach this work is, I think, really important. We've got a couple questions coming in, but I do definitely want to ask you one more, which is another key commitment of ours is excellence. And I what I see again and again, especially through your work, Brian, is that by being very smart about what we're doing, by analyzing the data, by choosing better practices, not only do we help drive down our emissions, waste, and cost, but we deliver excellent care. Could you comment on that a little?
Yeah, I think that it harkens back to what I mentioned a second ago about it, applying attention to stewardship through a clinical quality lens, and using that process to prospectively plan out your scope and measures to make sure that that the interventions that we plan to reduce our environmental footprint also take into account clinical safety for our patients, clinical efficacy, financial cost, and environmental cost. And in the end, that's kind of the cultural transformation that I hope that we can all move toward is to adopt a new healthcare value proposition that incorporates environmental cost on equal, if not higher footing than financial cost, because the environmental cost has such clear and devastating downstream health implications.
You bet. And as we've talked about the social cost of carbon, which is a high number, it's a lot of dollars, and those may well be underestimated, but that turns the cost of inaction into millions, if not billions of dollars just for us. It's really interesting to think about. I do have a question that came in from outside, and we have just a couple minutes. Does Providence now or plan to train clinicians and caregivers to be more mindful of using products during patient care? So I think we've both been working on that a little bit, but how would you answer that first?
Absolutely, and I think the linen life cycle assessment example is a perfect example. So last summer, when we went through the work of doing that life cycle assessment, it wasn't just out of academic interest. It was to use that information to fuel another educational initiative, looking at linen consumption and reaching out to the caregivers in all clinical units, because linen is, a ubiquitously used resource in healthcare. So it does have a broad reach across all clinical units and environments. So that's what we're planning to do this year, this summer in the Oregon region, is to re-engage caregivers specifically around linen utilization and relying on this underpinning of understanding environmental impact of clinical decisions. And once you take a project like that through, and you have kind of a proof of concept, the next one becomes easier, and the next one becomes easier, and people expect you to step forward with similar stories and similar types of information. And this is one that we're going to start with beyond anesthesia. And I hope that we continue to find great examples and continue to drive that conversation.
That's great. And I know from working with you how much we both, as do others on our team, depend on data. And so by having access to that data that we've been so doggedly trying to collect, that gives us the stories to tell, to say, hey, here's how much linen you used per adjusted patient day, or how many blankets per case, or whatever those normalized metrics may be. So I think that's super helpful. And I hope, to the questioner, that yes, this will spread in pockets until we develop, and I'm going to tell you now what we're developing soon, which is a clinical collaborative for environmental stewardship in Providence. So any of you who might be listening who are from Providence and would be interested in that, keep your eye open for it, or you can email either Brian or me, and we'll be developing that over time. Because what we have identified today is scratching the surface of the potential we have to do more quality improvement, more cost savings, and really drive down our emissions. In fact, I think that we're really depending on clinical input to transform healthcare in the way that we need to in Providence to decrease our emissions. So I think we are out of time. So Brian, thank you so much for spending this time today and sharing your passion and knowledge. It is so interesting. And to all of you who are tuning in, thank you for joining us, and we will see you again soon.
Thank you, Beth. I appreciate the invitation.